Show brought to you by Lagos Traffic Radio 96.1 FM. So last week we talked about the anatomy of the eye and the intricate process that allows us to see. Today we're going to be diving into something more practicable and relatable. Common eye symptoms. Now, with today's topic, our goal is to move you beyond assumptions and unanswered questions about your eye health. Rather, today we're providing you facts and just like we always do, we'll take a very closer look at some common symptoms that, a few of us have actually experienced. Now, to guide us through this important conversation, we're joined once again by our very brilliant Dr. Priscilla Imade, an optometrist with a PhD in public health, a fellow of both the American Academy of Optometry and the Nigerian Optometrist Association, and a consultant optometrist at Modern Eye Care Foundation on Molly Ojudibaja. Good afternoon, Doctor. Welcome to the show.
Good afternoon, Akan, and good afternoon, every listener out there.
Okay, so I noticed the intro was a bit of a mouthful, but we had to, I'm your forerunner, so.
Anyway, as for associate optometrist,
yes,
it's okay.
I'm waiting for my certificate though. So, Doctor, can you rate how Lagosians in particular respond to eye symptoms? And maybe share a few, anecdotes or experiences where people assumed it was a minor irritation or something, only for it to become something serious.
Yeah, actually, when we talk about eye symptoms, let me first of all explain what symptoms mean. Symptoms are what, as your subjective experiences. That means what you, as the listener,
is going
or as
through.
the patient, or as the individual, what you experience, the kind of changes or sensations that you notice about your eye. Sometimes these things cannot even be explained. Another person may not even be able to understand what you're going through. It's unique to you.
Yeah.
You are the only one that can actually, say out or try to tell exactly what is happening to your eyes.
Okay.
So, for example, when you come into an eye clinic and you tell me, "Oh, Dr. Imade, my eyes are paining me," those things you are saying, or you say my eyes are red, those descriptions that you give to me as a doctor about your eye is what we call symptoms. Then, when you tell me those, by the time I examine your eyes as an optometrist, whatever I find inside your eye is what we call signs.
Okay.
So often you may hear, the doctor says signs and symptoms. Or when you read books, you may also see, both of them going pari passu. So what are those common symptoms that you experience at home that is a pointer to the fact that something may be going wrong with the eye? Those are the things we are going to look at this afternoon. Number one on my list here is blurry vision.
Okay.
If maybe we are just beginning the year now, maybe sometime last year, or even before now, last week or wherever, you notice that you are no longer seeing clearly the way you used to see before. You may not be able to exactly pinpoint, how blurry the vision is, but somehow you will just notice within you that my eyes are no longer sharp. Sometimes when you want to read maybe your book, your Bible in the morning, you just realize that it's no longer as clear as it used to be.
Okay.
Or now you are making more efforts to even read those prints compared to the way you read last year or some time ago. Once you start noticing those, we call that blurry vision.
But
sometimes
Doctor,
too.
Sometimes when I wake up in the morning, it also happens like for a few seconds, or for some people, a couple of minutes.
Well, most time when you wake up,
Yes.
your body may take time to reset, but you'll be able to draw the line.
But is that normal though? Is that normal?
It's normal for everybody because
Okay.
you are lying down. By the time you stand up, it will take time for your brain to reset.
Acclimatize, yeah.
Yes, and acclimatize to the environment. But it should be in a matter of seconds.
Okay.
But this one that we are talking about is prolonged subjective experience. You just realize that you are no longer able to read. Even when you are looking at things that are far, they are no longer as clear as it should be.
Yeah.
So once you notice blurry vision, that's a symptom. And also symptoms are feedback. There are ways your eyes they are telling you, giving you information about your eye health, on the need for you to visit an eye doctor or see your optometrist. And most time, if you ignore those feedbacks, those warning signs, it may result in more serious conditions. I can have seen patients who would come to me and they would tell me, Dr. Imade, I used to see, intermittently, as in sometimes it's clear, sometimes it's not clear. I just felt it was normal.
Like
and by
weather.
the time they
Like the weather.
and by the time they are coming to the clinic, it's a lot of damage would have been done.
Dear.
So these are symptoms that one should not just overlook. Another common symptom I find around here is redness in the eye. In fact, we had a screening this morning. I just noticed that quite a number of the patients we saw, their eyes were red. We're like, why are your eyes red?
They were seeing a lot. They've gone through a lot.
What are they saying? I can't. I've started again.
It's pepper.
So redness can be as a result of infection.
Okay.
So the eyes actually could be red. And when it's red, especially, it's now a recurring decimal.
Okay.
You need to just come to the eye clinic for checkup. That's a common symptom pointing to another problem in the eye. Also, eye pain. So these are many people, they complain of eye pain. Eye pain is one of the reasons people come to the eye clinic. Pain is not anything one wants to just bear. Once it's painful, we are all looking for ways to just avoid the pain.
Yeah.
So if the eye is always paining you, no matter the degree of the pain, it's good for you to just come for an eye examination. That's a symptom that you should not ignore at home, because pain actually could be referred. It could be referred from, someone else. And if you ignore it...
But how would somebody, ignore pain? Pain is pain.
It's just like you keep saying that maybe people are thinking about the money they will pay in the eye clinic. Actually, pain is not something people ordinarily we should just bear. Another thing I find out is that people who have such pain, they start looking for home remedies.
Yeah.
Instead of coming to the eye clinic so that they will be treated properly and then given the right medication, or the right diagnosis is first and foremost done to know what is even causing the pain, because sometimes the pain may not even be from the eyes.
True.
The pain could be referred from some other organs in the body. Yes. So it's good, any kind of pain at all, just come to the eye clinic. Let's find out what is happening.
All right, doctor, can we quickly just look at the traffic situation now? There was an earlier report. We had an impediment at Ogudu Inwards, Alakpere, which of course resulted in a backlog of traffic up to almost Ifako. Well, at this time I have this on. This update telling us that impediment is off the road and it's a better movement on that stretch now. Back to you, doctor.
Okay. So another common symptom I noticed around here is itching. Hi, so people can scratch their eye for Africa. I saw one patient. He said, "Doctor, anytime I'm scratching my eye, the eye is sweet." He said, "So I'll just keep scratching, and then by the time you finish scratching, the eye will now become red." I mean, even common sense will tell you that you are damaging your eyes, because by the time you finish scratching, the eye is red. Is it better than what it was before? So itching is a common problem here, and there are quite a number of causes. Our weather, the dust, the wind, the smoke, air pollution, they can actually irritate the eye and make, want to just start itching. Sometimes too, conditions like allergic conjunctivitis can also make someone to just scratch the eye. But as optometrists, we encourage you not to scratch the eye. If the eye feel itchy, you can just wink, or you can get napkin, just put it inside cold water.
Well, doctor, it's weird when you just see me winking and they will even think I'm making signs at them. You just see me stand and I'm winking like that.
Must you wink at somebody? I didn't say wink at people.
So just wink at
Wink on your desk.
Any
Wink
other
at your
solutions
book.
apart from winking? What else can we do?
Just put napkin inside cold water and put
Napkin,
over the eye. The
cold
itching will
water.
come down. Or come
Okay.
to the eye clinic.
Okay.
Especially when it's persistent. Come to the eye clinic. By the time we check you, there are medications we can give you that can actually take care of
Yes,
the itching.
the
Please
itching, okay.
don't scratch your eyes. And if it's an allergic condition that is causing it, by the time you come in, we'll do a case history, find out what is actually causing the irritation, and look at ways to address it so that at least you can have comfort. Also, people feel a lot of dryness in the eye, especially within this Harmattan season. You just feel like your eyes are dry. Some people say, oh, maybe because they did not sleep well or they didn't drink enough water and things like that. I had a patient told me that he's always washing, her face. Anytime she's at work, you just take out time, go and wash face. Well, it's good to wash the face, but if your eyes is always feeling dry, there could be a more serious condition you need to address. We have tears in the eye that actually lubricate the eye and keep, the eye moistened and then nourish the eye anytime you blink. So if there is a problem, you can result in what we call the dry eye syndrome or the dry eye disease. And any feeling of such can, be checked in the clinic. Also, some medications that you take can make your eyes dry. People who are diabetic, for example, if they are taking diabetic drugs, hypertensive medications, and any chronic ailments actually can sometimes give you that feeling of dryness in the eye. So it's good to just come for eye examination. Also, tears, water, teary. There's a driver that told me, says, doctor, anytime I'm driving, especially when I'm driving long distance, after driving for about 30-40 minutes, before you know it, water will just start coming out from my eye. And because of that, I have one napkin, in my vehicle that I always use to clean my eyes. So watery eyes is another symptom. So far we have talked about blurry vision.
Yeah.
We have talked about redness. We have talked about dryness, pain, itching, then watery eyes. Also, light sensitivity. It's another common symptom. For some people, they just can't stand light. Once there is light, they want to close their eyes, or they want to use their hand as a shield, or they just want to squint. And there are quite a number of factors that can cause, or make somebody have discomfort anytime he's looking at light. People with refractive errors, especially like myopia, they want to squint. And people too have issues with their cornea or infections in the eye also can result in light sensitivity. Or another word for light sensitivity is photophobia. That's fear of light. So any of these symptoms,
so
don't just condone it.
Okay, so let's just the phone lines for those who would love to reach out to the doctor on the show now. Would love to hear from you. 091-538-77127. Any eye ailments you might have, the symptoms we've been talking about, you'd love to just talk about them. You could just share on air. 091-538-77127. Dr. Priscilla Imade is still here, and she's ready to, address any of these eye challenges and eye symptoms you might have noticed. And, especially those people that, the eye, the scratching. Doctor, that's I don't know. Okay, but I have a question. It's been at the back of my mind. Now, okay, we already have a call.
Put it at the front of your mind.
Yes. Okay, it's about the light sensitivity part, but let's take this call. Hello.
Hello, good afternoon.
Good afternoon. Nice to have you with us. Your name and location, please.
My name is Kayode Afolabi. I'm calling from Egbeda Axis.
Okay, please go on.
Well done, madam.
Thank you, Kayode. Happy New Year.
I wish you the best, mommy. Well done, ma. Please, what could have caused a 12-year-old boy that water will be dropping from his eye? Just 12 years.
A 12-year-old boy and has water dripping from his eyes. Okay, doctor.
From the eye.
All right. Let the doctor respond to this. So you could just listen via your radio. Thank you very much, Mr. Kayode Afolabi. Well done. Okay, so doctor.
Yeah, thank you. A 12-year-old boy most likely will be in the secondary school by now.
Yes.
So the volume of academic work is much, and if he's always teary, most likely it will be when he's reading, doing his school work, or maybe watching television and things like that. It's most likely that child has a refractive error that was not detected early.
So that's making him strain his eyes.
Yes. There could also be some pathological conditions if the eyes are infected, or also in the eye there we have some holes in the eye that when you blink the tears actually pass through.
Okay.
We call them the punctum. Sometimes for some children they may be blocked, and the parents may not know. Maybe they didn't do proper eye examination when the child was young. So for such, you just find out that the child will always just be teary. But most likely for this boy, I feel the child may have a refractive error that is not corrected. So please, sir, Mr. Kayode, just bring him for an eye examination so that we can examine him and make an accurate diagnosis and then tell you what to do. That child does not deserve to suffer just like that, because that tearing actually is inconveniencing to him. It discomforts him. I've had children who say because the tears keep coming out from their eyes, it affects their writing, it affects their schoolwork, and then they are not always able to just focus or concentrate whenever they are doing their academic
It can
work.
affect the grades and all that.
So it can lead to a negative school experience. Just bring that child for an eye examination so that he can be treated properly. Okay? Thank you, Mr. Kayode. We can also talk more after this program so that we'll know what to do about him. All right?
Another call this time. Our very own Elder Tewogbade. Welcome.
Good afternoon.
Happy New Year, sir.
Happy New Year. You never saw this year. Well done.
Thank you, sir.
And welcome back.
Thank you very much. Greetings from Canada.
One of these days, I will just come and pack all the things you bring for us.
In fact, we are waiting for you.
Thank you.
Yes, sir.
This summertime, does it have any effect on the eye?
Okay. Very well.
That's my question.
Okay, thank you very much, sir. Yeah, so Harmattan affects the eye. Weather condition, whether it's rain or whether it's sunny or anyone at all. In fact, some people experience what we call allergic conjunctivitis based on the seasons, of the year. Some during rainy season it gets so bad, while some during Harmattan it gets really, really bad. So generally during Harmattan season the weather is dry.
Yeah.
The air is it's because of the dryness. The eyes are irritated and windy, dusty, and before you know it, the eyes could be infected. So we generally encourage people that if you notice that during Harmattan, you should protect your eyes when you are going out. Take enough water. Sometimes you may have what we call tear supplement, and make sure that you are just okay, so that the Harmattan does not damage the eye. So that's everybody. I hope that answers your question. Harmattan can actually affect the eye, so protect your eyes during Harmattan season. Quickly, other symptoms that you can experience at home include double vision. Some people say, oh, they are seeing double. You just open your eyes, see there is two. Before you know it, maybe it clears off again. If it's persistent, please, you need to come for an eye examination. And then floaters. Some people also see things within their eyes. I've had people tell me, Dr. Imade, anytime I'm looking at something, it's as if there's one wire moving in the eye, there's one line moving in the eye. It's as if there's cobweb in my eyes, or there's a black spot, or something just moving inside the eye. If you notice any of those things, please come for an eye examination. And then it can even get worse for some people. They say, oh, we see flashes of light. It's as if NEPA is sparking inside my eye, or there is a light flash inside the eye.
Is that normal though?
That's not normal. In fact, that one is even more serious, because it could be a sign that the retina is actually detaching.
Oh dear.
Yeah, so you need to just come for eye examination. Also, swelling and puffiness. There are some people, anytime they sleep and they wake up, the eye will just swell. every time. Immediately they close their eye to sleep. Even some in the afternoon, they say, doctor, this is not even only in the night again. No. When I sleep in the afternoon now and I wake up, my eyes are swollen. Sometimes say the eye will gum together. There is discharge around and all that. These are symptoms telling you that something is wrong with the eye, that you should actually pay attention.
All right, we have a question on WhatsApp. Good afternoon, doctor. An 11-year-old girl complaining of seeing colors. Please, what can be the problem? This person didn't tell me his or her name, but of course, okay, let's just address that.
Okay, what kind of colors is he saying? What does he mean by colors? Well, for an 11
spectrum of color, just see colors.
Well, the child can do a color vision test for that child, but most likely the child may have a refractive error. So that refractive error may not make that child to see adequately. Okay. So just we advise that you bring the child for an eye examination. It's not normal for 11-year-old to be seeing colors, maybe within the eye or maybe when he's looking at objects. You know, there are color deficiencies as well that sometimes some children are born with. Some too may be acquired. But they just need to bring the child for an eye examination so that we can understand exactly what they mean by the child seeing colors. Okay.
All right, doctor, we seem to have run out of time. Wow. Yes. So let's just see how we can break things, just wrap things up.
Okay. There are quite a number of symptoms. So, yeah. Anyway, depending on the one you are experiencing, we have talked about eye discharge, eye swelling, seeing flashes of light, floaters, double vision, light sensitivity or water coming out from the eye, tears, redness, dryness, and blurry vision. The bottom line is this: symptoms are feedback mechanisms. There are ways your eye tell you that you need attention. Something is wrong. Go and see your optometrist. So any of these symptoms that you have experienced repeatedly, or even some that we have not listed here, there are even some symptoms that you yourself you cannot explain, but you just know that something is wrong with the eyes.
Questions pouring in.
Come and see your optometrist.
We have more questions coming in on WhatsApp, but unfortunately we might not be able to answer all these questions, but we'll definitely forward them. We might have to just gather this up for you who just talked about the mother having blurry vision and all the other people. It will definitely get down your number and reach out to you at the end of the show.
Do not forget,
Dr. Priscilla's book, I Care the Right Way. Yes, I Care the Right Way, Simple Guide by Dr. Priscilla Imade. Do make sure you cop a copy. Make sure you get that, and just do yourself a favor. Let that be your gift for yourself in this new year. So you can arm yourself with information and you'll be able to do things the right way as regards your sight. We know how important eye health is for maintaining a good quality of life, and we're committed to helping prevent vision loss, and that's why we're bringing this show week in, week out. Thank you for your feedback on the topics we have discussed, and we encourage you to keep sharing them. Please do go back, visit our Facebook page, our YouTube channel. Facebook page is Lagos Traffic Radio 96.1 FM. You can go to our YouTube channel, Traffic Radio 961. Search for the keywords Eyes on the Road, and don't forget, do not watch alone. Share. Dr. Priscilla Imade, an optometrist with a PhD in public health, a fellow of both the American Academy of Optometry and Nigerian Optometrist Association, and a consultant optometrist at the Modern Eye Care Foundation, situated at Omole Ojudu-Berja, Lagos. Of course, the address of the eye hospital is plot 16 to 18, Ogunusi Road, opposite Omole Estate, Phase 1 by Akiode bus stop. And you can reach them on, this is at Ojudu-Berja, you can reach them on 080-3333, that's 3 in 4 places, then 6672. 080-3333 6672. And on behalf of the production team led by Micah Arocha, assisted by Olame Benita, and not forgetting our executive producer Tayo Akonle, and yes, of course, our intern here, what's your name? Oyewole Deborah. You're welcome. My name is Akan Usen, wishing you all the very, very best. Safe travels to your destinations. Bye for now.